have a great new year. Thanks a lot for joining in. Well, moving on, the biggest story yesterday, and perhaps one of the reasons why the markets in India fell, is because after 2 months, the Union Health Minister has chaired a meeting of the COVID task force as infections have risen across China. Now, the central government has urged all states to conduct genome sequencing of positive samples to keep track of emerging variants. The advisory to citizens is to wear a mask in crowded places, even as the government insists that there is no reason to panic. We are now joined by Dr. Gagandeep Kang, the Professor Microbiology at Christian Medical College, Vellore, and Rahul Guha, the MD and CEO at Thyrocare, to give us a sense of what's happening on the ground. Dr. Kang, good morning, and Rahul, morning to you as well. Dr. Kang, I want to start with you. Although there is no reason to panic, it's always better from the government's end, I guess, to be proactive, and that's what they're doing. But for the people watching you right now, what is your advice?
It's no different from what has been happening in the past. This idea that everybody must suddenly start to mask up is, I don't think, completely appropriate, because I think we have to think about why we want to wear masks. And certainly for people who are vulnerable to protect themselves, it's important to wear masks, not just from today onwards. It's been something that has been important to prevent respiratory infections ever since we realized the value of masks 2 years ago. And for people who are infected with COVID, not just with any specific variant, it's important to make sure that if you encounter other people, then you should be wearing masks to prevent spread of infection to others. This applies not just for COVID-19, it applies to any respiratory infection, including influenza.
Ma'am, the current, I guess, the reason why this is what's happening in China, right? I mean, they're finally reopening, and naturally cases are on the rise. From that perspective, I mean, is there a need for more vigilance incrementally, in your opinion?
Well, I think there was never a need to relax vigilance on the part of government in order to be able to detect strains that are circulating in other parts of the world as well as in our country. So a standardized surveillance looks at all severe respiratory viral infections and identifies those causes of severe respiratory virus infection. This is something that should continue. It should be ramped up when there is a threat in your population, such as with outbreaks, where sequencing should be intensified. Or if you think that there is going to be virus that is going to come to you from other parts of the world, you could look at, as the government is doing, screen for new variants that might be brought into the country.
Ma'am, let me ask you very pointedly: is there is there risk? Is there additional risk because of COVID? I know what you're saying. No, you're saying no. Nothing has changed.
No, I'm saying no, because the situation in India is not the situation in China.
Exactly.
China is in for a bad time.
Yeah.
They are going to have a lot of infections. They are going to have high levels of mortality, particularly in their elderly population, because they have not had prior exposure to the waves of virus that we have seen, and because their population has received mostly only 2 doses of vaccine without a booster. And that's very important for the elderly population. In India, we have the advantage of hybrid immunity. We have experienced all the waves of the virus, and therefore our population has effectively been immunized not only by our strong immunization program, but also by the fact that we have had high levels of exposure. So severe disease and mortality are unlikely to happen in India, as they will happen in China. But there are 2 specific aspects we need to consider. One is that this is an Omicron variant, which in general is not as bad as the Delta variant. But the second thing that we have to remember is any time the virus replicates at a very, very high level, the chances for mutations and of new variants arising become high. So being watchful about what emerges from China is very important.
Well said, ma'am. Rahul Guha, the MD and CEO Thyrocare, is also with us on the show now. Mr. Guha, if you could tell us what is it that you are observing in terms of COVID-19 testing? Has it gone up? What are the trends currently?
Thanks. I think for us, overall, I think COVID-19 testing over the last few days has been kind of in line with what it used to be. So we aren't seeing a spike in testing at this point in India. But we always believe, prepare for the worst and hope for the best. So at least at Thyrocare, we are gearing up. We are ensuring that our labs are ready. Until now, we have processed almost 50 lakh, more than 50 lakh COVID samples at Thyrocare. And we're just ensuring we're geared up to meet the needs of the nation should the need arise.
Okay. Can you tell us a little bit about, okay, so you're saying at the moment there is no spike in COVID testing, but you are prepared in terms of if there is any kind of, fallout of what's happening in China. Is this the situation the same along the industry? I mean, is the entire industry prepared? And this time around, are there any special protocols being put in place? Is there any preparation being done from not just from a path lab standpoint, but from an industry standpoint?
I think because of the volumes of COVID testing being so down over the last 6 months, I think the supply chains have not been tested for a spike. So, just getting ready in case there is a spike, I don't think our supply chains right now are ready, with the kind of inventory required of kits, reagent, as well as, just the lab readiness. So I think just recognizing, that if there might be a spike, and I fully agree with Dr. Kang that at this point, there's nothing to panic. But in the situation in which we see a new variant into the Indian population, we are just making sure at Thyrocare that, our supply chain is at the same level of efficiency, let's say 1 year ago, when we were processing the level of samples that we could and making sure the supply chain is ready.
Dr. Kang, just one more question. Yesterday, we had Dr. V.K. Paul, who said that only 27 to 28% of India's eligible population has taken the precautionary COVID-19 dose. Do you think there is going to be a drive from the government to increase this booster dose to make sure that more eligible percentage of the population takes this booster precautionary dose? Is that something that we should expect from the government?
I think it would be really good to also see data from the government to show us the effectiveness of the vaccines that we've seen so far. And that would help us decide on why and which kinds of populations really need a booster dose. Right. It's very clear from the rest of the world that the elderly and those with comorbidities definitely need an additional level of protection that they could get from booster doses. But for the general population, which has had 2 doses, which has had a high level of infection, is a booster dose really necessary? I have not seen that data from India as yet.
All right, Dr. Kang, thanks very much. Rahul, great to have you with us here. Appreciate you joining in with that. By the way, look at the moves yesterday. I was looking at the Thyrocare chart. It went up $100 basically, 15-16% after Dr. Lal and Metropolis. Thyrocare was the one which was up 15%. That was a big one. Volumes were some of the highest we've seen, at least in the last 4 months. We'll take a break here. We're back. We're running into market pre-open at least, 9 minutes to go. Our technical experts will be with us on the other side.